Hello students, welcome back to Easy Nurse, where nursing education made easy. So again we are welcoming you in our Lakshya 3.0 live session for the Nursing Foundation 1 and 2. So mainly in this session we are going to deal for the BSc first semester and second semester students, and the exams are knocking in your door and I know you all are worried about that, but don't worry, we are Easy Nurse here for support you and guide you. So in this session we'll give you most important overview and then topics related the Nursing Foundation 1 and 2, which will be definitely come in your exam, as well as you will get an idea how to present. Okay, so let's start about today's session. So first is the meaning of nursing. So first we have to know what is the nursing. So mainly the goal of our nursing profession is nothing but promotion as well as preventions of physical and emotional well-being of the people. How? By providing them with a comprehensive care, support and advocacy. And same way for improving the health outcomes, it's mainly include the assessment, their intervention and education. So see the definition. The unique function of a nurse is to assist the individual sick or well in the performance of those activities contributing to health or its recovery or to peaceful death that he would perform unaided if he had the necessary strength, will or knowledge. So that is the definition of nursing, and this definition is given by the Dr. V. Henderson in the year of 1960. So as a healthcare workers or as a nurse, we have a scope to heal the physical, mental as well as social and spiritual health or well-being of each and every people who all belongs in our community. So let's see nursing as a profession. This is most important question for the 5 marks. So mainly this profession is nothing but an occupation's vocation or career, especially the specialized knowledge of a subject or from that particular field or science which is applied in that particular field. So that is the profession. So it is mainly usually applied in occupation which is involving the prolonged academic training and a formal qualification. So if you see the nursing background, so to get a nursing certificate, you have to go through the 3 years or 4 years a proper training with a proper certificate, and you have to gain the knowledge about the nursing field. Then only you will be considered as a nurse, right? So what is the qualities and preparations? First is love for fellow men, honesty and loyalty, discipline and then obedience, alertness and intelligent observation, dependability and adjustability, ability to inspire confidence. Same way, economy of time, material and energy, sympathy and empathy, intelligence and common sense, patience and sense of humor, good physical and mental health, and gentleness and quietness. So now come to the ethics of nursing. That is also most important questions, that is code of ethics. So mainly this code of ethics is nothing but it is a set of a boundary or the ethical principles which was accepted by all the members of a profession. So what all are the ethical principles? Obviously first is the accountability, is nothing but ability to answer for one's own questions. Next is a reasonability. Then confidentiality means suppose one patient that doesn't want to reveal their own problems or own diagnosis or any other things to the other members or family members. So as a nurse you have to keep it confidential. Don't have any right to disclose it. So that is the confidentiality. Autonomy in the sense right to make one's own decisions. Non-maleficence means it is duty to do not harm, means intentionally or unintentionally we don't have any right to harm the patients. Beneficence means doing good. Justice, fairness. Then fidelity in the sense to be faithful to the agreement as well as the promises what you are doing to your other colleagues as well as to the patients and their family members. Next is a veracity, is nothing but refers to telling of truth. So now come to the ICN or International Code of Ethics of Professional Conduct. So first is professional responsibility and then accountability, nursing practice, communication and IPR or interpersonal relationship, valuing the human being. It should not be based on any culture, any language, any religion or any other barrier. Next is the management, like the critical condition and normal situation, then professional advancement. So now come to the elements of code ICN. So first is nurses and people. So in this it is a primarily professional responsibility for all the nurses to care care the people who are requiring the nursing care. So nurses, they are holds in confidence personal information and the uses and judgment in sharing this information. Next is nurses and practice. So in this they are most carries the personal responsibility and then accountability for the nursing practice. So the nurses at all the times they are maintaining the standards of a professional, which is reflect mainly well on the profession and then enhance the public confidence. Now come to the nurses and profession. So the major role of our profession is nothing but determining and implementing the acceptable standards of clinical nursing practice, management, research and education. So this nurse is active in developing a core of a research based professional knowledge. Now come to the nurses and co-workers. So the nurses sustains a cooperative relationship with a cooperative in nursing and other fields. So mainly the nurses, they are taking the approximate action to the safeguard individual, their family, communities when their health is endangered by a co-worker or any other person. Now come to the therapeutic position. So while we are providing the nursing care, so that time comfortable therapeutic position is much more important for the doing procedure or providing the comfort to the patient. So therapeutic positions are nothing but it is a posture which is mainly used for the treatment of a patient to promote the emotional healing, pain relief or relaxation. So first is a supine or dorsal recumbent position, Fowler's position, prone position, lateral position, then Sims position, the lithotomy position, knee chest position, kidney position, orthopenic or the tripod position, and then Trendelenburg position. So these all are the complete like normal basic procedures or basic positions to do the procedures. Okay, so if you want to know about the what are the procedure is doing in this position, then what is the advantage, disadvantage, how to keep the patients in those positions, if you want to know in detail, then go to the easiness applications and see the classes. You will get a better knowledge. Okay, now come to the next, that is comfort devices. Comfort devices in the sense like during the bed rest or while their patients is resting on the bed, so that time some device we are providing to the patients to feel a better comfort or to provide the proper support to that particular body part. Okay, so first is a back rest, next is the knee rest, then foot rest, then bed cradle, sandbags, next is bed blocks, then air cushion, rubber and cotton rings. Okay, and last is the air and water mattress. So for different conditions, different comfort device mainly used. Suppose for the backrest, if the patient is having any surgery on the spinal cord or they are having any special ulcer on the back side, so that time from the hospital side they are providing the backrest. Same as like knee rest for the knee fracture or knee replacement procedure or any other therapy, they are providing the knee rest. Okay, so same way like rubber and cotton rings mainly to immobilize the joint pain, their joint areas, they are providing the rubber ring, and cotton ring they are providing specially on the ball socket joint like knee, then shoulder, etc. So rubber ring only they are wrapping with a double layer or triple layer cotton, so that is called cotton ring. Okay, so the different comfort devices is uses different purposes. Okay, if you want to know more detail, then go to the easiness applications. Now come to the back care. That is also one of the most important, especially for the bedridden patient to prevent the pressure ulcer. Okay, so back care is nothing but it's cleaning and massaging the individual's back as a therapeutic and comfort measures to prevent the pressure ulcer. Okay, so to mobilize the circulation system, so that is called back care. What is the purposes? Relieve the muscle tension, promote the physical and mental relaxation, relieve the insomnia in the sense like a lack of sleep. Okay, and next one is the relieve stimulate the blood circulations of the backside, and next is assess the conditions of the skin, mean patency of the skin, then physical structure, everything we have to assess. So that is the purpose for the back care. Now come to the types of beds. So while as a nurse you are entered in the hospital, so first your role is a bed making. So there are different kind of bed you can see in the world. Okay, so there are so many types of bed. First is a simple bed. So under the simple bed there are closed bed, open bed and occupied bed. So closed bed in the sense like side rail should be there and all the bed equipments like Macintosh, bed sheet, linen sheet, top sheet, bottom sheet, everything should be in prepared. So that is the closed bed. Now come to the open bed. Same way closed bed how they are preparing, same way each and every sheet they will keep in ready, neat and clean way, but the side rail should not be present. So that is the open bed. And occupied bed in the sense same way they will prepare each and everything, like how they are preparing the closed bed and open bed, but they will keep a proper top sheet from top to bottom to prevent to get any dust on that bed. Okay, so that's why it's called as a occupied bed. And when the patient is shifting to the from another ward to that particular ward, or from the OPD to that ward, so that time before coming only they are occupied that bed with a money or with the proper registration system. Okay, so that's why it's called as a occupied bed. So as soon as possible the patient will reach in the ward, we have to give that particular bed. Now come to the special bed. Same way like operation bed, for the recovery room mainly they are using. Cardiac bed, it's nothing but like table like structure. So what happened, it is helping for them to prevent the back sores as well as to mobilize the spinal cord, and also it is helping the patients to having the foods and all. Next is a blanket bed, amputation bed. If the patient is gone for the amputation for any limbs and all, so that time they are shifting in amputation bed, fracture bed, burns bed. Okay, so these all are the special types of the bed. So if you want to know more detail how to do this, what is the procedure, what is the advantage, what is the disadvantage for this particular beds, like simple bed and then special beds, and then go for the easiness applications, it will help you to give a proper overview as well as proper knowledge regarding the bed making procedure as well as each and every type of the bed. So bed making is also one of the most important questions for your theory as well as for your practical. Now come to the next, that is chain of infection. So in this first chain of infection, it's come to the infectious agent, means what is the bacteria, virus, microorganism, fungi, everything. So that is called infectious agent. After that reservoir in the sense who is getting that, means either animal or human being or any other factor. So that is the reservoir. Okay, after that portal of exit, means suppose one person is infected, so from that how it's coming through the nasal system, means when they are sneezing, coughing, so it's the virus is coming as a airborne disease. Another uninfected person, they are getting through the inhalation. So like that it is coming, or it's coming through the feces, or it's coming through the urinations or whatever. So that is the portal of exit. Now come to the mode of transmission, like airborne disease or waterborne disease, or example like foodborne disease. Okay, so through how the that bacteria or virus are passing from an infected person to the uninfected person. Okay, now come to the portal of entry. Suppose the infected bacteria or the virus is entered in our nasal system, so after that how it will enter in our circulation system. So if it's coming through the inhalation, so what will happen, it will go to our lungs, right? So they will affect on our lungs, and then it will create a disease on our respiratory system. So that is called airborne disease. Suppose if the mode of transmission is waterborne disease or the foodborne disease, so what will happen, after consuming that particular contaminated virus or food or water, whatever, then it will go to the directly to our intestine and stomach, right? So it will create a digestive system related diseases. So that's why portal of entry is much more important. And next is a suspectable host. Suspectable host in the sense like which age group of people are mostly related to that particular disease condition, means in the sense like whether which group are the more as a porn area to get that particular disease, either children or adult or school age children or preschooler children, so based on the age group. So that is the suspectable host. Okay, so these all are the chain of infection. This is mainly important for the 2 marks questions. Now come to the next, that is nosocomial infection or hospital acquired infection. So mainly it's developing when the patient is staying in a healthcare facility and it was not present when he was admitted in the hospital. So most nosocomial infection, it is transmitted by the healthcare personnel, and hospitalized clients are at the risk of such infection because the environment provides exposure to a variety of the microorganisms that the client has not been exposed in the past. Now come to the biomedical waste management. It is also one of the most important questions. So biomedical waste management in the sense it is a segregation, collection, treatment, transportation and disposal of the hospital waste by maintaining a proper guideline. So it is mainly part of a hospital hygiene maintenance, infection control and maintenance of activities. So see types of biomedical waste management. There are total 10 category of the biomedical waste. So under the category 1 it's coming human anatomical waste. Under category category number 2, animal waste. Under category number 3, microbiology and biotechnology waste. Category number 4, waste jobs. Then category number 5, the discarded medicine and cytotoxic drug. Under the category number 6, that is soil waste. Under the category number 7, that is solid waste. Category number 8, liquid waste. Category number 9, incineration waste or the ash. And last is category number 10, that is chemical waste. So these all are the categories of the biomedical waste. Okay, so now come to the segregation. So what do you mean by the segregation? It should be done at the site of generation of the waste, like patient care activity area, diagnostic theater area, then operation area, or labor room or treatment rooms, etc. Okay, so it is mainly duty of the waste generations like doctors, nurses and technicians, other healthcare givers. Now come to the collections of the waste. How we have to collect? So collection bags must be labeled with a biohazard symbol as per the guidelines with a non-washable and then prominently visible labels. So trolley, they must be used to collect the hospital waste without any leakage or the spillage. The waste must be transported, and you have to just remember the separate containers with different colored plastic bag at every point of the generations must be kept for the waste disposal as well as the collections. Okay, and the color bag, it should be replaced. Garbage bins must be cleaned with a proper disinfection solutions regularly. Now come to the storage of waste. So it involving mainly the holding the waste for a certain period of time at the site of generation till it get treated as well as disposed. So no untreated waste is stored between a period of 48 hours. So if it is stored above 48 hours, then it requires the permissions from a prescribed authority. Suppose as example, if a placenta may be there are discarding, okay, with a proper yellow bag under category number 1, right? But if they want to that particular placenta for the histological assessment or histopathological assessment, so that time they need to keep for the 48 hours, minimum 48 hours. Okay, so that's why they need a proper consent from, so that is the permission of prescribed authority. Now come to the transportation of the hospital waste. So within the hospital, how you have to transport? We have to avoid the passage of waste to the patient care area. We have to separate the time schedule for transportation of waste, and dedicated wheel container, trolleys or carts with the proper label we have to use, and trolleys or carts should be cleaned and disinfected in the any kind of the spillage. Now come to the disposal outside of the hospital. So at that time, through the vehicle specially constructed for the purpose, having fully enclosed body lined and naturally with a stainless steel or aluminium to provide a smooth surface which can be cleaned. The driver's compartment separate from the load compartment, and the load compartment provide with the roof vents for the ventilation. Now come to the treatment of the waste. So this liquid waste must be treated using the 1 part of the bleach to the 9 part of a contaminated liquid. Say liquid let stand for the 20 to 30 minutes. So total equation is 1:9. So after the treating, they have to dispose down the drain with a lots of water. So see the color coding of the bag. So under the yellow or the plastic bag, they are under 1, 2, 3 and 6 category number waste we can describe it. And what is the treatment option? Incineration. Now come to the red. So for the red, that is disinfected container, plastic bag, everything we can discard. And what is the waste category? 3, 6 and 7. So autoclaving, microwaving as well as chemical treatment is the main treatment process. Next is a blue or white transparent. So in that we can discard the plastic bag, puncture proof container. It's mainly puncture proof container they are using as a white. And so what is the waste category? 4 and 7. So autoclaving, microwaving, chemical treatment, distractions and shredding they are using. And under the black, that is only plastic bag, 5 and 9, and then 10 as a solid disposal, and disposal is secured landfill. So these all are the color coding of the waste, biomedical waste. But it is the variation is you can see in hospital wise. Okay, now come to the fluid replacement therapy. So what is the fluid replacement therapy? It is a replacement of abnormal fluid and electrolyte losses due to surgery, trauma or any other reason. So maintenance of a daily fluid and electrolyte balance, corrections of fluid disorders, collection of electrolyte disorders. So there are several types of solutions solution. First is isotonic, that is 0.9% sodium chloride, lactate ringer solutions or the RL. Then hypotonic means 5% dextrose and water DNS, 0.45% sodium chloride and 0.33% sodium chloride. Now come to the hypertonic, so 3% sodium chloride protein solution, and under the colloid dextrin, albumin as well as the gelatin. So these all are the types of solution, and that is also one of the most important for the 2 marks question. Now come to the next, that is pain management. So sometimes they'll ask you in a 5 marks questions like non-pharmacological method of pain management. Okay, so that time you have to go through this. Okay, so this is also one of the most important questions for the 5 marks, non-pharmacological method of pain management. So first is a injection. So if they're asking specifically non-pharmacological, then you can put this point, that is injection, because it is under pharmacological, and under that you can give any other medication name. Now come to the massage, then hot and cold application, acupressure, relaxation, hypnosis, nutrition, exercise, positive attitude, central lateral stimulations. So how these factors is relieving the pain for that particular patients. If you want to know more detail, go to the easiness applications. Now come to the next, that is critical thinking. So what do you mean by the critical thinking? Suppose in the critical situations, the pain nurses and the doctors, they have to think critically how they can treat the patient. Okay, so that is the critical thinking, and it's obviously self-directed and then disciplined cognitive thinking. It is a process of analyzing and evaluating informations or situations as a systematic and then reasoned way, and it's mainly involving actively questioning assumptions, considering different perspective, and then making well informed decisions. So what is the characteristics of critical thinking? Analytical, open-mindedness, creative, curious, inference, communication, compassion, objectivity, problem solving, awareness, questioning, observing, and then active listening. So what is the process of critical thinking? It is area 5 phase. Okay, first is identify what is the case, and based on that we have to provide the proper critical thinking capacity. Next is the appraisal, then problem solving, evaluation, and then analysis. Now come to the principles of drug administration. That is also one of the most important questions. So nowadays it's a 10 principles. First is right medicine, means before administration we have to check the medicine name with a proper prescription, right dose, right time, right route, right patient, right to educate, right documentation, right to refuse, right assessment, and right evaluation. So these all are the complete 10 principles of drug administrations. Okay, now come to the phases. So what do you mean by the phases? The composition of phases is nothing but it is a very complex, and it's very based on the several factors including diet, hydration, and individual health. While the exact compositions can differ among the individuals, there are some general compounds you can find like water, undigested food particles, bacteria, dead cells, bilirubin, fiber, mucus, gases, then minerals, as well as compound from the bile. So what are the characteristics? First is the color. So color, it faces as brown, which is typically due to the presence of bilirubin. Now come to the consistency. So in the consistency you can see feces should generally have a soft and firm consistency. Shape, the shape of the feces is typically cylindrical and then well formed. Then odor, feces have a distinct odor which is largely due to the presence of gases produced due to the bacterial fermentation. Then frequency, in the sense normal bowel habits, it's vary among the individuals, but a regular and then consistent pattern which is generally considered as a healthy. Now come to the presence of blood. So blood in the stool can indicate the various issues ranging from a minor conditions like a hemorrhoids to more the serious conditions such as gastrointestinal bleeding. Now come to the mucus content. So small amount of the mucus is very normal in the feces which help with the smooth passage of the stool. And gases, the presence of gases in the feces which is contributes to the flatness or the intestinal gas. So these all are the main characteristics of the feces. So bowel, for the bowel elimination, what are the factors they can might be affect? That is diet, physical activity, medications, fluid intake, age, stress and anxiety, illness and infection, hormonal changes, neurological conditions, structural abnormalities, laxative use, and then pregnancy. So how these factors are affecting the bowel elimination? To know more detail, subscribe the easiness application. Now come to the alterations in bowel elimination. So it's nothing but it is a refer the change or the deviations from the normal patterns of bowel movement. So this alteration can might be occur due to the various conditions affecting the frequency, consistency or other characteristics of the stool. So some alterations and is very common, that is constipation, diarrhea, irritable bowel syndrome, inflammatory bowel disease, hemorrhoids, bowel obstruction, diverticulosis, gastroenteritis, then celiac disease, as well as a colon polyp. So what are the main what is the meaning of those particular disease name, how it's affecting the bowel elimination, how it for which conditions the bowel elimination pattern is becoming altered for the patient. So if you want to know more detail, then subscribe the Easy Nurse application. So now come to the next, that is condom drainage. So what do you mean by the condom drainage? Condom drainage is nothing but it is a medical device which is mainly used or designed for the man who is mainly experiencing the urinary incontinence, and also it is known as an external catheter or the Texas catheter. Okay, so through the externally they are handling it, so that's why it's called external catheter. Unlike traditional internal catheters, they are inserted into the bladder. A condom catheter is an external device that fits over the penis. Okay, so what is the material? It consists of a sheath similar to a condom which rolls over the penis. So the sheath is connected to a tube that lays a drainage bag. So what is the types? Condom catheters come in various sizes to ensure a proper fit. There are also different types of the adhesive or the non-adhesive catheter depending on the individual preference and the skin sensitivities. Now come to the use. So condom catheter, they are mainly primarily used for the managing urinary incontinence in the male which was caused by the prostate tissue, nerve damage or any other surgery, and also it is rolled on the penis and secured in the place. So that tube attached to the sheath is when connected to a drainage bag typically worn on the leg. Okay, so these all are about condom drainage. Okay, now come to the intermittent catheterization or the internal drainage. So in this intermittent catheterization, it is a medical procedure which is mainly used that empty the bladder for the individual who all are unable to do so on their own. So this method is mainly involving is nothing but inserting the catheter into the drain urine and then removing it once the bladder is empty. So that is the intermittent catheterization, but there are several types of catheter. Is there straight catheter, caudal tip catheter, hydrophilic catheter, closed system catheter and pocket catheter. If you want to know more detail about each and every types of catheterization, go to the Easy Nurse application. So what is the uses of intermittent catheterization? So mainly the doctors, they prescribe for conditions such as spinal cord injury, multiple sclerosis, urinary retention and other neurological or the urological disorders. So intermittent catheters, they are mainly used for a short period of empty the bladder and then they have a removed. So what is the sterility? Proper hygiene and sterility are crucial during the catheterization process for prevention of infection. Technique is nothing but it requires a proper technique. So individual, they should be trained by the healthcare professional initially. Lubricating the catheter can help erase the insertion. Now come to the disposal. So after use, the catheter should be disposed of properly. Which color? That is red color. Okay, and some catheters are designed for a single use and should not be reused. Now come to the indwelling catheter. So indwelling catheterization is also known as a Foley's catheter. It is a medical device which is designed to remain inside the bladder for an extended period. So indwelling catheter are connected to a drainage bag to collect the urine continuously, and it is a most preferable catheterizations in the hospital. Okay, because it can give you the long-term validity. So what is the design? Like balloon shaped structure you can see. So indwelling catheter, they have a inflatable balloon near the tip that is filled with a sterile water once the catheter should be inserted. So how you have to insert it? First you have to take the lubricant on the end part of the catheter and then you have to press it over through the clitoris or for the male, that is through the penis. Okay, and until the bladder until when it will reach until the bladder, so that time you have to stop it. Okay, after that what you have to do? You have to take the sterile water in the syringe and you have to press it on the balloon. Okay, so through the water pressure it will stay on the bladder. So that is the process of indwelling catheterization. So what is the insertions? So it is mainly the bladder through the urethra, in some cases through a suspectable incision in the lower abdomen. So uses cases like a post surgery, using after certain damage surgery involving the pelvic region for assist the urinary drainage during the recovery period. And medical condition, it may be causes of urinary retention, neurogenic bladder dysfunction or other conditions where the normal flow of urine it should be compromised. So now a drainage system. So catheter it is connected to a drainage system which is collect the urine. So care and maintenance is nothing but regular cleaning and balloon maintenance. Potential complication like infection, bladder spasm, blockages. Duration of use in the sense temporary or the long term. So indwelling catheter can be used temporarily during recovery from the surgery or illness, or if they may be required a long term basis of chronic conditions. So it is mainly essential for the individual with the indwelling catheters to receive the proper education on the care and maintenance. Now come to the urinary drainage. So its refers is nothing but process of removing all the urine from the bladder and collecting it and then external receptacle. So this is a very much common for the individuals who are unable to void the urine naturally or the efficiently due to the several medical conditions or the post-surgical situation. So intermittent catheterization, which is involves the periodically inserting a catheter into the bladder to empty the urine. Indwelling catheter or a Foley's catheterization, it is inserted and remains in the bladder for an extended period. It's often connected to a drainage bag. Suprapubic catheter, it's nothing but it is inserted through a small incision in the lower abdomen directly to the bladder. Then external collection device. So condom catheters for the males which are designed to fit over the penis and collect the urine in a bag attached to the bag. Now come to the urostomy. So in cases where the bladder is removed or non-functional, so they are creating an opening or the stoma in the abdominal wall to redirect the urine into the external pouch. And then urinary drainage bag. So its users or caregivers need to empty the bags regularly. Okay. Now come to the urinary diversion. So urinary diversion is nothing but it is a surgical procedure which is mainly reject the flow of the urine from bladder to the new exit point of the body. So these procedures they are typically performed in cases where the bladder they have removed or they with the normal urine flow through the urinary tract which is disrupted due to the medical conditions such as cancer, trauma or the birth defect. So there are several type of the urinary diversion is there. Okay, first is like in the procedures the segment of all the ileum or the small intestine they are used in a create of a like a condyle for the urine. So one end of the condyle which is connected to the uterus and other end which is brought out through a small opening or the stoma in the abdominal wall. So which cases they have used commonly performed a radical crystallectomy due to the bladder cancer. Now come to the external collection. So urine they are collected in external pouch or urostomy bag which was worn in the abdomen. Okay, so continue the like a continent cutaneous reservoir or the Indiana pouch. So its reservoir they are created using a portion of ileum and colon. So the reservation is connected to the uterus and then valve machines is constructed to control the release of urine. So this stoma they is created for the catheterization. Next is the orthopedic neobladder. So its neobladder it is a constructed bladder which was created from a portion of a small intestine or other bowel segment and it's also connected to the urethra to allow for the more natural voiding. Next is the cutaneous ureterostomy. So the uterus they brought through the abdominal wall creating the stomas for urinary drainage and this is a non-continent diversion. Now come to the mains pouch or the sigmoid pouch. So this pouch they are creating using a portion of sigmoid colon and also it is connected to the uterus. So this pouch is brought to the abdominal surface catheterization. Now come to the bladder irrigation. So bladder irrigation it's nothing but it is also medical procedure which involves the solutions of the bladder to flush out or cleanse its content. So this procedure which is commonly used in various clinical settings for managing the clinical conditions for preventing the complication. So what is the purpose? Like cleaning the clots or debris and preventing the catheter blockage. So what is the components? First is irrigation solution, second one is irrigation set. So in the solution normal saline commonly they are using as irrigation solution, but other solution also maybe they can use based on specific needs of the patient. Then irrigation set which is includes the tubing and a container for the irrigation solution. So tubing is connected to the catheter or the irrigation part. Now come to the diagnostic test. So there are several categories are there for the diagnostic test. First is laboratory test. So under that blood test means RBC, CBC, LFT, then RFT, everything, general test like completely body checkup and then biopsy. Now come to the imaging study. So under that X-ray, computer tomography scan or the CT scan, then MRI or the magnetic resonance scan, ultrasound to see what are the things are going on inside of our body. Now come to the functional test. So in this electrocardiogram, pulmonary function test, stress tests, etc. Now come to the diagnostic procedures. So as example, endoscopy, colonoscopy, angiography. Okay, now endoscopy with the liver related, colonoscopy with the colon related, and then angiography with the heart related. Now come to the molecular and then the immunological test, that is polymerase chain reaction, enzyme link, immunosorbent assay, and then western blot. Now come to the neurological test. So in this, like EEG and then lumbar puncture, and radiological test like radiological test, bone can, and then mammography in the sense like through the related the breast. Okay, so these all are about the diagnostic test. So for each and every disease condition we accept diagnostic test, we can't provide any kind of the medicine. Now come to the chest physiotherapy. So it's also known as a physiotherapy or the respiratory physiotherapy. So it's set of the techniques and then interventions which is mainly aimed for the improving respiratory functions and maintaining the respiratory condition. So there are several steps are there. First is breathing exercise like deep breathing or the pursued lip breathing. Next is a cough techniques like effective coughing or the huffing. Next is the airway clearance technique like postural drainage and then chest percussion or vibration. Incentive spirometry, mobility and exercise, and assistant device like positive expiratory pressure device and oscillatory positive expiratory pressure device. So these all are about the chest physiotherapy. Okay, now come to the nebulization. Okay, now come to the percussion technique. So how the percussion it should go on for the chest physiotherapy, that is positioning the patient. It's usually positioned in a way which there allows the gravity to assist in moving the mucus from smaller to the larger airway. Technique means the therapist and then caregivers, they're using the cup hands or a percussion device to rhythmically tap the chest and back. Now come to the duration and frequency. So the duration and frequency of percussion which was depend on the patient's conditions and then therapist assessment. Next, combination with the other techniques. So for that the percussion they are often combined with the chest physiotherapy techniques such as vibration and postural drainage to enhance the overall effectiveness of the mucus cleanliness. Now come to the monitor and adjustment. So for that the therapist they monitors to the patient's response and adjust the techniques accordingly. So the main goal for helping the patients effectively clear the mucus and improve the respiratory function. Now come to the pulse oximetry. So pulse oximetry is nothing but it is a non-invasive method which is measured the oxygen level, heart level, oxygen saturation level in the blood and provides the information about the heart rate. So it is a very much variable tool for monitoring the oxygen status in various clinical settings. So there are several types of there, that is finger pulse oximetry, then handle pulse oximetry, wrist pulse oximetry, pediatric pulse oximetry, tabletop pulse oximetry, and then pulse oximetry probes. Now come to the next, that is drug forms. So there are several kind of the drugs are there which we are administering to the patient's body. So oral form means tablet, so chewable tablet, caplet, capsule, everything, hard cell and soft cell. So pastilles, dental cones, granules, pills, etc. Now come to the liquid forms like oral solution, oral emulsion, oral suspension, syrup, linctus, oral drops, then gargles as well as the mouthwashes. So these all are about liquid forms of the drug. So next one is the topical forms like ointment, cream, gel, pollution, then poultics as well as the lotions, and last is a rectal form, suppository enema. Okay, so these all are about the forms of drugs. So mainly from the drugs I can't give you like a most important topic, so I can say it like you have to go through or you have to read about each and every type of the drug administration, and also you have to keep it in mind for the injection, especially the like subcutaneous injection, how much angle should be maintained, 15 degree. Then for the dermal injection, for the intramuscular injection, how much, that is like 90 degree. Okay, and same way for the Z-drug injection, how much, 45 degree. So for the injection, while you are inserting the injection, how much degree you have to maintain, what are the procedure you have to maintain, and when you are providing the oral drugs to the patient, so that time what are the things you have to keep it in mind, that is the particular 10 principles. So 10 principles you have to follow for each and every purpose. But for the drug administration, how to do, what is the procedure, what is the advantage, what is the disadvantage, why IV administration they are much more needed in the emergency basis compared to the other procedure and all, how they have to give the nebulization, what are the procedures are there, each and everything is much most important. So you have to study about the drug administration. Okay, now come to the next, that is care of the dying patient. So caring of a dying patient, they requires a holistic as well as a compassionate approach, which is mainly they're addressing their physical, emotional and social or spiritual health. Okay, so under this, communication with the patient and family members, then pain and symptom management as like a palliative care, then comfort and palliative care, respect and dignity based on their religion, their culture, their thoughts, everything, family and social support, advanced care planning, psychological and spiritual support, cultural sensitivity, end of life care planning and grief and bereavement support. So these all are about care of dying patient. Means as a healthcare workers, when we are providing the care to the patient, so we know that the patient will be dying within a few days or within a few hours. So at that time we have to take care of the patient and their family very calm way and very maturely. Okay, now come to the death declaration and certificate. So this is the most important process which is occurring the person's death. So this process involves the formally confirming the date, documenting the essential information and the deceased individual, and that also issuing a legal document which is known as a death certificate. Okay, so and that time we have to follow some principles, that is confirmations of the date by checking each and every vitals, then notifying the authorities in the sense like doctors, then hospital administrator, everything, as well as family members, documenting the essential information, how the person has died, what are the drugs is given before death, so how the patient body was responding on the drugs, each and everything, then completing the death certificate by writing on the patient's name, patient's family status, everything, then issuing the death certificate to the family members, then registration of the death in the hospital record as well as to the MRD record, and next is obtaining the copies of a death certificate. So these all are about death declaration and then certification. Now come to the autopsy. So autopsy in the sense when the patient is gone through the any like abnormal death, as example suicide or accident or anything, so that time they are sending the body for a autopsy. Autopsy is nothing but it is a postmortem examination which is a medical procedure and performed by the pathologist for investigating the causes as the manner of the death by examining the disease the person's body. So autopsies mainly they are providing the valuable information about the underlying disease, injury, conditions which is mainly leading the individual's death, and they are typically performed in the cases where the cause of death is uncertain, unexpected or the suspicious. So if they have the suspicious death, so they are ready to take the like legal action. Okay, and so at that time the postmortem report or the autopsy report is much more needed to prove it as a proof. So what is the overview? First is authorization and consent from the patient patient family members, as well as if it is a crime section means from the police station. Next is the external examination, then internal examination, histological examination, toxicology testing, then documentation and reporting, as well as communications of a result. Okay, so these all are the steps of a autopsy. Now come to the next, that is embalming. So embalming is nothing but it is a process which is mainly used as a temporary preserve and disinfectant the dead bodies, slowing down the decomposition process for allowing the viewers, funeral services and transportations of the body. Okay, so from suppose one person has death in abroad, so while they are transferring the body, so embalming should be done. So some chemical composition is there which they are preserving the body with that particular chemical composition, so the like smell as well as decomposition of the skin, everything will be reduced. Okay, and it involves the use of chemicals to sanitize as well as temporarily inhibit the growth of bacteria and other microorganisms which can accelerate decay. So what is the process? First is preparations the dead body. Next is arterial embalming, means in the arterial side we have to do the embalming process, so the each and everything will be kept in properly and the patient will look like a freshly dead. Next is a cavity embalming, if any cavity is there due to postpartum and all, so that also we have to do the embalmed. Next is a surface treatment, setting features and dressing and casketing. Okay, now come to the death care or the last office. It's also known as a last office. Okay, so death care is nothing but it refers to the rituals, practices and then procedure which is mainly involved for caring for the like decrease the person's body after death. Okay, so it's mainly encompass the various culture, religious, personal custom which was aimed at the honoring as well as respecting their deceased, preparing the body for the burial or the cremations and providing the support to the bereaved family members. So So here are some steps are there for providing that: body preparation, embalming, weaving and visitation, funeral or memorial service, burial are the cremations, then grip support, cultural and religious customers. So if sometimes in the 5 marks they will ask you like explain about the care after death, so that time you have to do you have to write each and everything, okay, till the death care. So this is also one of the most important question for the 5 marks and 10 marks. So in this session I discussed so many important topics. Other than that, you also have to focus some more important topic, that is blood transfusion. How to do, what are the need to check, okay, if it is like controversial blood group, so what will be happen, like Rh factor, Rh negative factor, if it is there means what will be happen for the O positive like patient, if you give the A negative blood, so what will happen. So this each and everything you have to study. Next is the IV fluid transfusions. What are the types of solutions, when we have to give, what is the ratio of the IV fluid calculations, why we need to give, what is the purpose, everything. Care of the unconscious patient, like especially the Glasgow-Coma scale and their reading, okay, Glasgow-Coma scale and their reading. So when the patient you will be considered as a coma, so each and everything you have to study. Care of terminally ill patient, nursing process, that is also one of the most important for the theory as well as the practical, okay. Nursing process in the sense like a data collection, physical examination, then setting the goals, objectives, after that planning, implementation, evaluation. So that process completely you have to keep it in mind full your nursing journey. Next is the sexuality. Full chapter is important, I can't give you the most important topic. Next is a nursing theory. There are several theories are there, full like basic nursing, as well as if you do for the go for the higher study, that time also you have to study that nursing theories. That is also one of the most important, I can't give you any specifics, especially in that I can prefer you, that is Nightingale's theory you have to study, okay. Next is administration of drugs in a different routes. So these all of the most important topic rather than this topic. So I know nursing foundation is very vast syllabus, you are very much tense, but don't worry, we are easiness there. If you want any guide or if you want to know any answer or questions, we are always there. So take the subscription and stay tuned with the easiness for becoming more healthier as well as to becoming more stay tuned, okay, about the health related topics. I hope you all understood my sessions. Again, we'll meet you next session. Till that, keep learning and stay tuned with the easiness. Thank